and English because anyone in Thai like to use Thai and I will say English to you, all right? Okay? โอเค
Okay,
สวัส
sounds
ดี
good.
ค่ะก็ขอต้อนรับทุกท่านนะคะเข้าสู่ AI Special Session ค่ะดิฉันนางสาวประภชญาหานานะคะเป็นนิสิตเภสัชศาสตร์ชั้นปีที่6นะคะจากมหาวิทยาลัยมหาสารคามค่ะก็จะรับบทเป็นผู้ดำเนินรายการในค่ำคืนนี้ค่ะสำหรับคืนนี้นะคะเราก็จะพาสมาชิกทุกท่านนะคะพบกับการเจาะลึกประสบการณ์กับการประยุกต์ใช้เทคโนโลยี AI นะคะจากแนวคิดเนี่ยเข้าสู่โซลูชันที่ใช้จริงในเชิงเภสัชศาสตร์ค่ะ ก็ we honor to welcome our special guest Arshia a people's pharmacy student from University of Toronto Canada Arshia will be sharing career insight from his experience as part of clinical team during his S1 pharmacy practice rotation as Zebra. Arshia, are you ready for our presentation? All right.
Yes.
The floor is yours. Please begin your presentation.
Thank you, Jubjang. That's great. I'll take it away from here. All right. Well, hello everyone. I'm not sure how famous I am there now, but my name is Arshia. I'm a pharmacy student here at U of the University of Toronto in Toronto. Can you guys see the slide? Jubjang?
Yes.
Clearly.
Okay,
Yes.
perfect. Perfect. All right. Well, today I'll briefly talk about a bit about AI and like what the world is around here in Canada, at least in the Western world right now. And I'll tell you a bit more about my experience at the CEPHA, which I did one of my rotations in for about 6 weeks. And then I'll leave the room open to any questions. I think that would be probably the most valuable part where you guys just ask me anything you want to know about what's going on here around on this side of the world. All right. Sorry, the system is just a little laggy, so I might have to just present them one by one. Okay, first let me tell you about a little bit about myself to you guys. So my here for you to become a pharmacist, it's not like you guys to go from high school. I think you go to a 6-year program. You have to do an undergraduate degree first in in the same university or a different university. So my path was first through Western University in Ontario, which is the province that Toronto is in. A very good medical university. So that's mostly where I got interested in the field of science and medicine because I ended up doing a lot of research there in cancer and in radioactive isotopes. And you see at the bottom here, that's the hospital that I used to work at for the longest time. Not the best environment. That hospital did not smell very well. A lot of geriatrics there, which is like just older patients. So not a great scene. Got me a bit discouraged from hospital. But that's where also my path to pharmacy started. This is the first pharmacy I ever worked with. This is one of the chain pharmacists in pharmacies in Toronto now. And that's my first experience ever as an undergraduate student to work in a pharmacy. Then I got accepted into the University of Toronto School of Pharmacy. That's it right there. Beautiful building. And as we go through the 4 years of pharmacy school here, throughout the different years, you get to work at different places. Two of the most famous that I wanted to mention is first is Shoppers Drug Mart. That's a very famous chain drugstore here in Toronto. I've been working there since my year one, so it's been about 4 years now that I'm with them. One of my most recent rotations though was Cepha, an AI-based company. Throughout our years here, we get to just like you guys, as I know from my talks with Jubjang, that we have different rotations. These rotations could be in different sites, different practices. That includes hospital, pharmacies, industry, research, even administrative stuff like working at offices, working in university. So, and one of those for me was Cepha. So I'll just dive into that real quick for you guys. SFA is probably one of its own kind. It's very unique. Nowadays, with AI being so big, a lot of the companies, including Pfizer, Biogen, Amgen, like these are all big pharma companies over on this side. I'm sure some of them are also in Asia also. They all have a component of AI in them. They're all trying to get into this business. They're all trying to get into this race. So they're all attempting in one way or another to get in the AI world. But ASEFA is a bit more unique as it was created about 3 years ago by a computer engineer and a pharmacist duo, their CEO and CTO. The CEO, Eunice Yan, I believe is her last name, is actually a 2020 University of Toronto graduate. So she graduated about 5 years ago from U of T, and she basically built a Cepha 2 years later. And they are purely AI based. They're just an AI based company, and you see their mission, and vision here on the left. It's so they base their company around the workflow automation for pharmacies. So that's essentially all that they offer, and that's essentially all that the company is about. So their goal is to automate manual work in pharmacies using an AI-powered solution designed to maximize efficiency, increase productivity, and drive revenue growth. So within that company, some of the services they provide as of right now, these are services that pharmacies, hospitals, and other industries can actually buy from them and like start using. The first one is data RX entry, and I'll go through these first, and then I'll tell you like what the role of a pharmacist can be in every single one of these positions or services. So the first one is data or prescription entering, and as simple as that might sound, when you think about it, nowadays we're still in an age where digital and paper is still both on the table. Like we're not fully digital, especially on this side of the world at least, and we're not fully on paper. So then you need a software for that. For this to be a service, you need an AI software that can both read and understand handwritten notes from doctors, which I'm not sure how good those are there, but they're not great over here, and digital prescriptions, which are on the easier side probably. But one of the services they provide is data entry, essentially anything, any prescription, any service, any note that you give this computer or this platform, it will read it for you, and it would translate that into a digital product and then integrate that into your pharmacy system, whatever that may be. Next is hospital discharges. So over here, hospital discharges are just usually a long list of medications that the patient was either on or started in hospital. So a bit more concise than a prescription, and there's multiple of it on the same page, right? And then there's a lot of patient information usually on there about their weight, their height, their kidney function, so serum creatinines, and so on, liver function. So this platform is a bit more advanced essentially than just data entry. It would read all of these prescriptions, read the dates that they were started, and analyze that, essentially understand what day was what started, what's going on. It was the medication that was stopped, was there a medication that needs to just be taken once or twice after they're off hospital, or is there new medication that needs to be started? Which also plays into the third service, which is a medrec. This is something that pharmacists here at hospital especially do already. So if you're at a hospital, let's say you went in for an emergency and then you're getting discharged, you have your own medications at home and you're getting some medications at the hospital. A pharmacist's job is to essentially look at those two things, understand what's happening with you, what procedure did you go through, what new medications do you need to be started, and then combine that with what you've been taking at home, making sure that what you've been taking is safe, is effective, and then making sure that what you're starting to take as you're going out of hospital is still safe, or does it change anything in your home medications? Do your medications interact at all? So that's called medication reconciliation. And that's also one of the roles, one of the services that ASEFA actually introduced as for the first time as an AI-based service, where the platform, the software that it is, and mind you, these are all separate services. These are all separate. So because I've seen their back end of products, like these are all separate products that they offer. They could integrate them all into one website essentially, but they have different engines that these run on, whether that be the Sonnet engine or Gemini, or so these are all just different engines that an AI service can run on, and they essentially what the Cepha does is that they run all these services on these different engines and assess which engine does best for whichever product it might be, and then they choose to stick with one engine. So these services are all on different engines, they're running on different platforms. They could be combined, but they're not on the backbone. So yeah, medication reconciliation, that's something that I think it's on the Sonnet engine that they run it right now. And they essentially so the AI system essentially just gets the list of medications from their home and the list of medications from hospital and combines the two and makes sure that there's no repetitions, there's like no same drug with different doses or mentioned twice. Make sure that the medications are fairly safe. Like if there are interactions and stuff, it doesn't stop anything or it doesn't do anything per se. It just tells you, it just gives you an alarm, gives you an output. As you know, this medication was mentioned twice. This medication was at home at a lower dose. Now it started in the hospital at a higher dose, or the other way around. Or these two medications interact. Consult the pharmacist, consult the doctor before starting both of these medications at the same time. So that would be the output, essentially medication reconciliation, where it's definitely more advanced than what we're usually used to seeing in the AI world. It is kind of getting into what the pharmacist can offer, what a pharmacist can do, but it still needs your approval in the back end. It needs somebody to look over and make sure and adjust, make all those changes. Maybe one of the cooler platforms that they have is their AI voice assistant. And I'm sure you guys over there also have systems where like you call a certain office or like I don't know, even your university, and there is voice generator that responds. This is way more advanced than that. This adapts to certain voices, to different voices, and to different settings. It gives you a response to questions. It doesn't ask you questions to say, okay, what are you here for? Are you here for medications or like medication refills, or are you here for an appointment? It tells you, hi, how can I help? And then you start talking to the AI system, and it's fully responsive and it's trained on medications and medical scenarios, so it can understand a lot of the different and difficult words in pharmacy that most AIs won't. So as I was working there, actually, one of the jobs that one of the roles that I took on was actually training this AI voice in the pharmacy world, like with the different words and the different terms, and how well it actually understood different conditions and different medications and the difference between the ones that are very similar, like quinidine and quetiapine. Like these two are completely different medications, very similar pronunciation though. And so like to basically make this service more advanced and more tailored towards a pharmacy world. That's something that I, as a clinical pharmacist there, essentially was helping them with. And the last service I have here is like a back office assistance that essentially is just AI working for the company at the end of the day. So it would just show them different trends, how the company was doing in certain things, in certain services, which softwares are working the best, which are have higher demand. Like these are all things that when you have a company based on AI, you can essentially automatically get this feedback from these services and like from what you have going on. And it also helped with the appointment scheduling for them, whether that be their own meetings that they had with different people as they were meeting with the industry, with different pharmacy companies, or whether that would be setting up appointments for their customers coming through. So this is something that essentially was making a schedule for them, and they would edit it from their own end, but they would just give them a preliminary schedule of like what their month was going to be like, which I thought was really cool to just have that given to you as a company. So now going back to all these services and our role as pharmacists. So in like the first three, essentially data about prescription entry and hospital discharges and med recs, you can imagine that's essentially what the pharmacist does. Like that's one of your main jobs. So what you could do as a pharmacist in these companies considering these services is first will train the platform or the engine that they're working with. So that would mostly be prompting, which I'll touch upon on a bit more later also. But prompting is basically writing a detailed um learning a detailed paragraph or note to feed to AI for it to be able to give you a service, produce you a service. And that is not as easy as it seems. I know a lot of us nowadays are used to using AI like ChatGPT, Gemini, and to get things done. But when I talk prompting in an industry setting, I mean prompting in pages. So by the end of my rotation, I had one prompt that I was working on for medication reconciliation, actually, which was 12 pages of prompting. This is 12 pages of just writing that you're instructing essentially the AI to, okay, first go understand what this medication is. Second, read up what the doses are, what the days are. Third, now compare this list of medication to the original home medication list. Then take step A, B, C, and D. So, and each one of those steps, you would have to write it out in detail to make sure that you're getting the result that you want. And sometimes you still don't. And that's when you even go in and you edit things and make it even longer, maybe put even more details in there until you get a result that you want. And that is probably just with one or two samples that you were working. Now you get to test this same platform with all the different examples that you can get. So all the different drugs and all the different drug states and disease states that a patient can present with. So two jobs here essentially for pharmacists. One will be the prompting or training a machine, an AI system to get better at doing a job like this, which is like a job that's a pharmacist involved, at least if it's not fully done by pharmacists, it's definitely pharmacy involved. Two would be the testing. So you can either have your own experience and have your own sources of medications and prescriptions that you can feed into the system to test it, or you can be creative as a pharmacist, right? You can, that's also one of the other things that I did at this company, that I was generating them random prescriptions that made sense, right? That were about a certain disease state, a specific drug, a specific dose, specific route for a certain time. And it made sense because it had to make sense for the machine also to be able to judge whether this prescription was a good one or not. So that's two jobs there that you can do. The AI voice assistant, I also helped them a bit with that. I told you with the pronunciating and like finding certain medications where the AI system might have struggled. This is not something that you knew already. It's something that you would think that, oh, these two medications are maybe similar in how they work and they're similar in how they're pronounced. So there's a chance that our system would suffer here. So that's something that you can fish out as a pharmacist rather than somebody that just doesn't have that background knowledge. All right. So that's a bit about my role and what SFI is. We can definitely talk about that later if you guys are interested. I just want to just briefly give you an overview though of also like what things are out there, like what is currently being AI is being used and what their future uses could be. I was actually going over this and adding some last night, and I think I missed one at the end there. But anyway, as of right now, as much as we might not even know what's around us, there's a lot of AI implementation that has already happened in the pharmacy world that we maybe didn't even know much about. And with the new current world being so big about AI, it's all becoming more and more obvious that that's the case. So one thing that here we learn a lot actually as pharmacy students to especially use, because it's always hard to keep track of what drug interactions are and how many drugs interact with what. So there's always softwares and helping tools that help you navigate those situations. And so one of those is the lexicon or up-to-date clinical drug interaction profile. And it's a very useful platform. It does a whole lot of things. It's mostly based on AI. It's mostly just given the platform and the guidelines and the knowledge that is out there in a validated pharmacy world. So there's obviously references that we usually go to for pharmacy that are validated. So this AI essentially is just given those platforms and those knowledge frames, and is asked to fish out drug interactions and find situations where drugs could be changed or need to be adjusted in certain ways. So that's mostly AI now. We have an image-based pill identification system where, like, if you have a certain drug in your hand and you don't know where it came from, or like you don't know what it is, or the patient doesn't know, that you could essentially just give this software an image or tell it what, like, if it's a round shape, if it's white, if it's yellow, if it has a line down the middle, and then it would tell you what this medication is exactly and what strength and everything. And that's also an AI-driven system, and that's powered by Phaser. MedSnap also has one too. These are two different AI pharmacy companies. I believe both of them are not AI-based like Acepha, but they're doing big things in the AI world. Next one is an AI-driven virtual assistant for patient communication, which is something that SFI is doing right now. They have completed this project and they're selling it essentially. So especially on this side, I guess I'm not sure how much of it will get over to you guys, but we'll see it more soon. Like, a lot of pharmacists and a lot of hospitals are just going to be AIs that you're talking to. Supply chain and inventory prediction. This is definitely one of the ones that has been a long time that AI has been implemented in this path, which essentially just tracks which medications you use the most, what your patient demographic is, and so predicts like what medications would be using going forward. It also tracks seasonal things. For example, like flu shot is huge right now here. It's been 2 months that everybody's trying to get a flu shot because it just came out and the flu season is ahead. So everybody's trying to get a flu shot. So that's something that this system would essentially predict and would tell you that you need to order an X amount of flu shots for the next 2 months. And Trace Medics is probably the most famous company in that sense. And yeah, they've been doing this for a while now. This has been used for a while. Personalized medicine is one of the more newer ones that is essentially just knowing somebody's genomics and genome background to be able to tailor their medications and their treatments to their specific gene or to their makeup, essentially. That's essentially what personalized medicine is. And you can imagine with that being an information base, so essentially you get a list of genomics data from doing a genetic test on someone. So then you can just feed that to AI and then feed them what medication they're taking, what they're on, what disease states they have. And it would give you what medications are best for this patient specifically, or what doses, or which within the same class, which medication is better than the other. So that's called personalized medicine. And Genox is a fairly new company also that is mostly focused on that. Fraud detection and opioid agonist therapy dosing. That is a big problem here. I'm not sure how big of a problem that is over there, but opioids, basically there's an opioid crisis here, which just comes from a misuse and a bad habit in prescribing opioids by doctors here on this side of the world. And so it brings a lot of problems for the healthcare system and for healthcare providers like doctors and pharmacists to have to deal with that. And so AI can be used in a situation like that too, where it tracks someone's history, or it makes sure that, oh, this new patient that you're prescribing opioids for, did they have a history of opioid use? Did they try opioid once and it didn't work for them? And again, going back to personalized medicine, also, if you know their genetic makeup, then you could figure out which opioid would work for them best. and what dosing range. Because I'm sure all of you guys know opioids don't is one of those medications that don't really have a roof. There's not a limit of how much opioid you can use for a certain person. If their pain is not managed, let's say, you can keep going up in that as long as they're awake, as long as they're still breathing. You could help them out with that and you can give them more opiates. So that's something also that genomics and AI combined together can give you an idea about that. Okay, what range of doses could potentially be safe and most effective in a certain patient? Now, in terms of future use, I try to keep it mostly onto about things that you might see recent, like coming in very, very fast and in the near future. And one of those is a real-time clinical co-pilot at the pharmacy counter, and that is essentially just AI responding to you when you show up to a pharmacy. It's not here yet, but I'm surely it will be because when you think about it, I'm sure when I talk about that, a lot of you might be thinking about robots and like you having to face a robot and talking to a robot, but that doesn't really have to be the case. It could just well be a screen that we're all used to. I mean, here at when you go to McDonald's, like as of right now, it's a lot of it is just not person facing anymore. It's just a screen that you go put your order in, and then they just get it for you, get it ready for you. So essentially, it would be the same system coming into the pharmacy practice where you wouldn't need anyone to be behind the counter. The people would just come with their prescriptions and their questions, and they could put that in the system, and then a pharmacist would take care of, or a technician would take care of their orders. And then once their order is ready, maybe they can ask questions or they can meet the pharmacist, but their first interaction doesn't have to be through a person. So that's what that means. Personalized drug dosing engines, which essentially are coming. Personalized medicine is definitely a world that AI is exploring a lot right now. So that is definitely in a new future. And using patient-specific biology is essentially going beyond genomics. So just doing it. So genomics is one component, and then there's an environmental component, as in what bacteria are in your body, how do you react to certain things, and these are all things that maybe are not so genomics, so much environmental maybe, but a combination of two is essentially what a patient needs, right? Is what a patient is. That they both have the genomic component and their microbiome and the environmental components. I have a couple more things here for you. Predictive adherence models that intervene automatically. That is mostly getting into what pharmacists would be doing. So I'm not sure about how well that would be implemented, but I definitely am sure that it will be tried at first. It will come to this to our services as of right now, but we'll see how that pans out because that will be more tapping into what a pharmacist does. And I'm not sure if we want to go there yet. And so with that one, we'll see. And then real time augmented reality compounding assistance. This is definitely something that will be very useful and should be coming through very soon, where you just have this would most likely be a robot and with an AI system backing it, where they would be doing the compounding. And as you can imagine, even though we have like scales and equipments that are very efficient nowadays, a robot doing certain compoundings or like certain mixins at a certain level, at a certain accuracy level, can be beneficial, where you can ensure like all the products that you mix or all the things that you use in your hospitals and your pharmacies that need to be compounded are held to a higher standard and are built to for efficiency and for perfection. So that is something that I'm hoping to see soon in the AI world and in the pharmacy world. And last, I have here AI that predicts drug shortages months in advance. This is already in use essentially for near future, so for the next couple of weeks or for seasons. But this is I'm essentially trying to allude the fact that this could be done for maybe a year or so, or maybe in 2 to 3 years, trying to predict. Imagine if there was an AI system that in 2015 predicted there's going to be COVID in 2020, and that we need to start making vaccines for that or for something similar to it starting in 2015. So that's essentially what that's alluding to, which can be very useful, which is kind of crazy, but that is a feature that can come along with AI. Okay, so I also wanted to talk a bit more about this, which is not really pharmacy related, but definitely it affects the pharmacy world. Maybe not something we really think about much. And that's how drugs are discovered and like how we end up having new drugs. I mean, over here, what we mostly learn and what most people go through is that once you have a certain problem or a certain disease state, there are proteins and there are receptors involved in that disease state, right? So for you to find a new medication, a great way that you can go about it is to find out those proteins and then use computer softwares to navigate and see what products or what drugs you can use to affect these receptors and to affect these disease states. But computers, as of right now, they can just be fed a certain information and then they could give you a list of compounds that you can, some of them you can make, some of them you can't. Some of them would actually be stable and good enough to be a drug, some of them won't. And then from that small list that's left, then you would have to yourself try every single one of these drugs to see if it works, see if it's functional, see if it's safe to give to a human. And eventually, out of the million options that you made, maybe one or two would be good options and good contenders to actually become a medication. So now with AI, though, that process can be a lot more streamlined and it could be made a lot faster. And so you don't have to have a list of medications, but you would have to physically go through and analyze. AI will do all of that for you. You will just give it a certain information, what a disease state is, what receptors or what pathways are involved. And then AI would essentially look back at all our experiences, all the medications we have for similar situations, and basically go through that list of potential drugs and potential solutions and give you a top three, a top five, the best one, even rank them from 1 to 10. And that will affect our world eventually down the line a lot, because we're going to see a whole lot of new sets of medications that are going to come into the world in the future, which are AI discovered or AI has put that in our radar. And I think we're going to see a lot more of that, which means we're probably going to get a surge of medication production and medication innovation in the next few years. All right. And the main takeaway that I wanted to give you guys, though, to take away from all of this, I know it feels kind of scary, seeing all this changing a profession as solid and as important as pharmacists and pharmacy world. But I hope you didn't see that a lot of the things and a lot of the services that AI provides right now that I was talking about, it mostly affects technicians and not pharmacists so much. So we can't really take away the role of the pharmacist, because what if AI makes a mistake, right? Then if you don't catch that, then who is even responsible? So in that sense, it is very hard to replace pharmacists, and I don't think any of us need to be worried for our lifetimes, at least, that whether our job is in danger or whether we're going to be replaced by robots. That does not seem to be the case. It's mostly here to help decision making, to fast forward processes and make things more efficient. It might take some jobs away along the line, but it's not here to replace pharmacists. That being said, though, does not mean that there's no way that we should avoid it, or that um, we shouldn't try to indulge in it as pharmacists. So I included a list of things that you might want to consider doing as you go through your careers, as you go through your paths, no matter where you are. Because I mean, you saw the services that I talked about. They could be anywhere alongside your pharmacy careers, pharmacy paths, whether that be in the pharmacy or in like independent community pharmacies, or in hospitals or in industry. AI will be everywhere. Any service that can be made more efficient will be made more efficient with AI. So that being said, there's obviously skill set that you guys can try to develop, you guys can try to learn about, be better at as you graduate, as you go through your pharmacy careers, to be able to both take in the role of AI integration into your systems or contribute to it, do it yourself. And that will be firstly digital literacy. So just know what AI is, know where it's used, know how what the progression of it is, keep up with the news about it because it's everywhere now. Data interpretation is very essential. So knowing essentially what to do with what AI gives you or how to know how to deal with information about AI. So for example, like if an AI system that you've made or your company has implemented is saving you 20 seconds for a certain job, what does that mean? Is that useful or is it better to not spend so much money on the system and actually hire someone to do that? So things like that. Workflow optimization essentially just keep an eye out for everything in your life that could be better, it could be done better with AI. Now that could be directly affecting you guys. You could have a pharmacy yourself and you could be implementing AI in certain ways and saving money and saving time for yourself. So and it could be with it where you work in a hospital in an industry position and AI will be all around you and you can try to figure out ways in which AI can help the systems around you. Prompt design. Now, I highlighted this one because this is probably the biggest jobs that will be out there for pharmacists. You guys having the knowledge background that you do in pharmacy are very valuable assets to certain companies and organizations. So if you can also get the prompt designing part down, which is essentially those pages and pages of writings that I was telling you about to basically give to an AI system for it to do a certain job, if you guys can learn about prompt design, whether that be through YouTube, Facebook, I don't care, but it's very important that you understand what prompt designing is and how detailed it can be, how intricate it actually is to do a good job at prompt design. Combine that with your background in pharmacy, it's a very valuable asset. It's something that a lot of us are going to be doing going forward for pharmacy companies. So keep that one in mind. Critical appraiser of AI outputs, which also goes into that data interpretation, right? So it's just being critical, being able to understand where AI is also lacking is like a very important job to know that, okay, where can we trust AI or where can we not trust AI? And a pharmacist needs to be involved. So that's also a very important component here. And ability to translate text to patients or teams. And that plays the biggest role probably in genetics and genomics, where like AI is going to be integrated a lot, but also understanding the outcome of it is not going to be easy. So things like that are going to be places where you as a pharmacist, having the knowledge and knowing how to work with AI and interpret outcomes are going to be really helpful. A lot of people are going to be, a lot of companies are going to be asking for you guys, are going to try and hire you guys for that specific reason. All right. Well, that's it for me. That's all I have for you guys for today. But I'm happy to take any questions. If there's anything you guys want to talk about, I'm here. And thank you, Jubjang, for this opportunity. I appreciate it.
All right, the next session. So I have the presentation for question from me. Yeah. Can I share my desktop, please? Okay, all right. Mm-mm. All right, the first question for you, Arshia. Think about your AI project. What's the biggest problem or lost bug you run into, and how do you fix it?
That's a hard question because in AI world right now, there's a lot of unknowns. There's a lot of things that face roadblocks. Almost, I mean, honestly, almost anything you try in AI right now, you can be sure there's gonna be a roadblock wherever you go. But for me, for my projects, I would say the frustration was prompting. Prompting is a lot harder than it seems. As easy as it is, as easy as when you consider like what it is, it's just like writing out in your own language what you want the AI to do, right? But these are just systems at the end of the day. And so what they give you back as a result is never guaranteed and it's never to the point. And so being able to tweak something you wrote in plain language a little bit just to get a different result it's harder than it seems. It's very frustrating at times. You spend days and days doing that and still no result. So that part was really hard.
Okay, right. The next question. Okay. What is an example of AI you have to see that really impress you or makes you say, wow, tell us what makes it so amazing?
Mm. As I was working with SFI, actually, their AI voice system was very cool. Like their AI system was very advanced, actually. Like the things that it understood, the medications it understood, the situations. Because, okay, over here also, when you have an AI voice system like that, you would have to also teach it to navigate whether a situation is emergency or not. As to, so, okay, do I transfer this call to my pharmacy team or do I tell this patient to call an ambulance? Like, are they okay? So navigating between that also, it's very hard for an AI, for a computer system, right? So in that sense, it was very well done that you could be having a full-on conversation about your medications and about what needed to be done, and then you would mention one thing which was essentially cross the line. It was in like a red line zone, and it would catch that and it would say, oh, for this part I can't really help you, you should contact the doctor, or like you should call an ambulance. And that was very impressive. Yeah, I guess like, and for me that most part of why that was impressive was that that wasn't really a system that we thought needed improving. Like we thought we already had a good computer system, but it can answer your questions. But AI came and made that so much better. So I think that's very impressive.
Yeah, that's good. Okay, next. If someone were to start their own AI project, what specific tool or tech stack do you think are essential or highly recommended right now?
Um, I can't say that there's a certain tools or techs that are out there that are best, just because how much is it's the world is advancing in the world of AI. I would say your best bet is probably just keeping up with news, keeping up with the companies that are doing this right. They keep bringing more and more tools. They keep bringing more and more ways that we can use AI. So keep up with that. That is probably your best bet because there's new things being invented every day. So I worked at SFA almost 4 months ago. They have two complete new services now in the past 2 months that I'm not even too sure what, like, how they did that, or like where it came from. But there was no talks about it. In 4 months, they have developed two new services. So I can't tell you a specific tool that would be very useful, but yeah, that, and also be familiar with the engines. I would say the different engines like Gemini, Sonnet, SX. These are all like different engines that almost perform a bit differently, and they have different tiers that you can use. So like there's one engine that Gemini has for image production, right? And that's different from the one that they have for prompts. So just be familiar with those, with the different engines, and like what comes out new. That would give you a head, so that would give you one head above everybody else.
Okay, the last question for me, what's the advice would you give to students who plans to enter the AI job market in the next 1 or 2 years? What should they start preparing for right now?
Um, the biggest opportunity that us as pharmacy students have that we might not really think about as much is our rotations. And now I don't know where you guys are along that line, but your rotations are probably your most valuable asset, because you get to just go work in a pharmacy company, right? For free, I guess, like free labor too. You get worked for free also, but that is the exposure like that is unmatched. There's nothing like that. Like if you can get a role at a certain company, at a certain AI company, that is I mean, like you're in it, then that is definitely the biggest exposure you can get. I would say if you guys can still do that, do that. But if not, I'm not sure how big volunteering is over there in Thailand, but it does have a component here. So even if you do get your jobs and you're still interested in going into AI, go work with an AI company for a day a week. Go spend some time with them. Offer them a free volunteer role that they could benefit from. You know, if you have the time, I know time is of the essence and time is hard to come by. But I would say, yeah, however way you can get your foot in the door with a certain company or with a certain group of people, that will probably be your best bet into getting a job down the line.
All right. Okay. The next session is our open for Q&A. So if you have two questions for Arshia, please raise your hand or type in the chat box. I will lead to Arshia. โอเคค่ะก็สำหรับใครที่จะมีคำถามที่จะถาม Special Guest ของเรานะคะก็สามารถยกมือขึ้นมาได้นะคะหรือว่าจะพิมพ์ในช่องแชทก็ได้ค่ะก็จะมีเวลาประมาณ5นาทีนะคะที่จะสามารถเปิดเป็น Open for Q&A ค่ะ
Hello.
Hi.
Can I ask you a question?
Sure, go ahead.
Um, about the Canadian Pharmacist Council allow the Canadian pharmacists use AI in real practice or not? And what is an emergency point that you think that it might be dangerous for patients?
So, sorry, the first part of the question, was it that Canadian pharmacies, do they use AI?
I would ask about like the Canadian Pharmacy Council allow Canadian pharmacists use AI in real practice or not? Or they're not allowed to? Is it, I mean, like, it illegal or not?
Right. Well, okay. So the services that I talked about mostly in the presentation, those are all services that are already implemented here in whether that be in the community pharmacy or hospital, like they're already there. For example, like supply tracking and telling like your pharmacy, okay, what are you gonna need most in the next 2 to 3 months? Like that is an AI software and AI system that is already implemented. And so Acefa also, they're a fairly new company, but their services are now being sold to all these different hospitals and all these different pharmacies, and they're using it because they're spending money on it. So they're definitely using it. But you do have a point about that there is an ethical dilemma here that, okay, how far can the system go? And how much can it take over a pharmacist's job? And that's why I guess I had that slide that that's not what it's going to be. That's not what AI is here for. Or at least it shouldn't be. There might be a company down the line which might try to do some to go past that line. But as of right now, whatever is used here in a pharmacy practice is watched and it's looked over by a person pharmacist. So medication reconciliation is probably the biggest pharmacist-based feature that I've seen in AI. That is something that should technically be done by a pharmacist. It is a bit of a dilemma trusting an AI system to do that. But even that right now, it does it for you and it gives you an output, gives you the pharmacist an output. It does not give a patient an output. It gives you the pharmacist an output, which you can then look over and make sure that it's correct. But it just basically makes your life easier, right? It catches some mistakes for you and it combines, for example, 2, 3 different lists of medications in an appropriate way. And then you can look that over and make sure that it's appropriate. But it's just here to help your process and your and save you time, not to take over or do something without your permission. I don't
Thank
know if
you.
that answers your question. Of
Thank you.
course.
Parmi, raise your hands.
Yes, I'm a 6-year pharmacy student, and you mentioned that prompt design is becoming an essential skill. And how did you learn prompt design, and what practical tip or technique would you recommend for improve this skill?
Mhm. So every engine, so let's say for example, Sonnet, once you go to their website, they have all of the engines have this. they have a tab for prompting, which tells you how should you prompt, because every engine is also different. So, for example, like it's kind of like programming. So in that sense, like how would like whether you should use dots or commas or whether you should line them one by one or whether you can just write a paragraph. These all almost give you a different output, but different engines. That's something that you can find on their website. When you go to Gemini, there is a tab in Gemini that explains and tells you about how to prompt Gemini. And I would say that's the best source, probably. That's the best way you can do that. There's also always all YouTube, right? And there is if it's like whoever you can learn. This AI, thankfully, is something that essentially is like computer science. And in that sense, wherever you can learn it from, you can learn it from. You know, there's no limits. There's no college of pharmacy coming down your throat being like, oh, you're not doing this ethically. If you can learn something about AI, do it. Yeah, so I definitely did watch some YouTube videos on people that are I just know are good at this or people that were I found to be valuable and valid in the field of pharmacy. So I learned from those, but I also learned a lot from just their own websites as to how to do things. Because each engine is also different and takes a different way of prompting for it to work. And also at the end of it, nothing beats you experimenting. Okay. If you think about what I just said today, medication reconciliation. Try to prompt an engine to do a medication reconciliation for you for a list of like 2, 3 different drugs. See how it does, and then see what you can change in what you say to get a better result. That I definitely learned a lot from myself from just my mistakes in the span of a couple weeks. Right, a couple of weeks of me doing that, I realized where I was making mistakes. What are some things that I wasn't being clear enough that the AI didn't understand what I was saying. And so that is also a great way. Just start working. These engines are all free. They're all free. So just start typing.
Okay, thank you.
You're welcome.
Anyone else? All right, firm. Okay.
You're muted. You're muted. It's firm, right? Yeah.
Sorry from my friend. Firm, you mute your microphone. Please open your microphone, please.
Oh, sorry. My name is Firm. I'm also 6 years pharmacy student. May I ask you a question, please? I think in Thailand, some people or some companies worry about the data leaking when they put commercial or patient data into AI platforms. So I was wondering, in other countries you have experienced, is the concern about patient data leakage also a major worry or not when using the AI, and how do you solve or handle that issue on your project?
It's a great question. Yeah, because at the end of the day, once you do give this information to a certain engine, you're essentially giving it to a cloud, right? That could be accessed. I honestly think as of right now, people are not too worried about this. Maybe they will be more down the line. Because as of right now, all these systems are closed systems. So the companies reassure you that, yeah, whatever you put in, it's saved, right? But then there was also Facebook, which was supposed to be the same, right? And then they ended up selling all the data they had to a whole bunch of companies. So yeah, so these are companies at the end of the day. If one of them decides to abuse this knowledge, who can stop them, right? I think that issue will always be there. It's not gonna just resolve or go away. But at the same time, something that we tried to do a bit of was so you can take patient identifiers out of these data, right? For example, if a patient's called John Smith, you don't have to put their name and their date of birth in there. Like you technically just need some sort of a number associated with it, right? And their weight, their height, like these are the more important things, right? So I would just call this patient JR, and just go from there. So basically just taking anything that would identify this patient as who they are, you can take that stuff out. You don't have to give it to AI, right? And that you're right that is not something that is generally being done right now. But maybe it is something that companies should consider. But at the end of the day, you are giving this data to a company that is not pharmaceutical. So we'll see. We'll see what they do with that data.
Okay, thank you.
You're welcome.
Anyone else?
One more question, please.
Sure, go
Yep.
ahead.
I want to know about like patient perception and patient's compliment of patient comments when you use AI even in your real practice in Canadians. What is the patients react to?
To AI?
Yes.
Yeah, it's a mix of everything, honestly, because when you consider like who these patients are, there's patients from all sorts of ages, right? There's 70, 80-year-olds that are our patients, and then there's young people like you guys. And it's different. With different ages, it's different. Younger people are definitely more accepting towards it. They understand it. They understand that it's useful and it will be taking over. Older patients still definitely have a harder time to understand, but some of them are still very open-minded. I would say it really very much depends on the person, how they want to interact with it. Some love it, some don't. Can't stop it though. It's here and it's gonna be here, so can't really stop it. But so like the best we can do is to try to explain to them what it does, right? Like what does AI do? Like how does it help? And I honestly myself hope that it never takes over, that it never replaces pharmacists, because I like seeing a person when I go to a pharmacy. I don't want to see a screen. I'm sure patients here are all the same too. Like when AI comes and brings a service that almost replaces humans, most people don't love it. Sure, like it can help the process get faster and more efficient, but you still want to interact with the human at the end of the day. And I think that's something that even if we do take away, then it won't work as well. There would have to be a human component left.
Thank you.
You're welcome.
Anyone else? If not everyone to have a question, we will have a next session is coursing session. All right, thank you Arshia for sharing such incredible real world insight, and thank you all for good participants. Today's section is highlight to how pharmacists must enroll to embrace AI for better pharmaceutical. Last but not least, we would like to take a quick go further. We invite everyone to please turn on your camera now and give us a big smile. Right. When are you ready for capture photo? Please.
I'm ready.
Thank you.
Okay.
Good.
3, 2, 1. Okay, thank you everyone.
This one. Thank you once again to joining AI Cup today. It's very special it's the first time to have a special guest. I wish you all have a wonderful night. Goodbye. Thank you all.
Thank you. Thank you, Jupjang.
Thank you for sharing.
Thank you.
Of course.
Thank you for
เดี๋ยว
sharing.
ทุกคน